talk. So hi, everyone. For those of you that I don't know, I'm Rebecca, one of the co-chairs of the kids group along with Shylin Coleman. And this morning for introductions, if everyone could just put in the chat, I think we'll do the chat, your name. If you're here representing an organization, you can share that. And then something that you're grateful for in the spirit of November and the Thanksgiving holiday if you celebrate. I'm going to introduce our first presenter today, Lauren Showers from Colorado Access. So Lauren, you can tell me if I don't get this right. You are the Program Manager of Member Affairs.
But good morning, everybody. My name is Lauren Showers. I'm the Program Manager of Member Affairs at Colorado Access. I am going to go through this presentation very quickly. Okay, so Colorado Access is the Regional Accountable Entity, or the RAE, for those with Health First Colorado, which is Colorado's Medicaid program. And so a RAE is made responsible for the care for their members in their region. So Colorado Access serves people with primary care physicians in Denver, Arapahoe, Adams, Douglas, and Elbert counties. Now, people tend to believe that this is based on their physical home address, and it is not. It is based on their primary care physician, which means we have a lot of kids who are assigned to Children's Hospital, University, Denver Health, but maybe they live in the outlying areas, but they're still Colorado Access members because that is where their primary care physician location is. Now, if somebody wants to change their primary care physician and therefore change their RAE, they can do so on the Health First Colorado app or website or by calling this number. Just really important to know that if people make changes to Medicaid, all the changes occur on the first of the following month. So if somebody makes the change today or the very end of November, the change will go into effect on December 1st. This is a map of the RAEs. So as you can see, Colorado Access has that navy blue and orange in the middle, and it is the smallest geographical area, but the highest in population. So people enroll in an accountable care collaborative, they're assigned to a RAE and attributed to a primary care physician location. So when people enroll in Medicaid, they can either say, yes, I want Children's Hospital as my primary care and select it. If they do not, there's this auto attribution method that happens all at the state that takes into account utilization, family connection, and proximity. This is not a perfect science. We have 80-year-old men assigned to Planned Parenthood all the time because family connection and proximity to whatever location. So people do have to change this. It happens at the state, and we get a big list of all of our members on the first of every month. And we don't really have a way of changing the primary care physician or the RAE. That all happens at Health First Colorado or the state's Medicaid program. Now, the RAE's responsibilities are to help facilitate the appropriate delivery and coordination of physical and behavioral health services for Medicaid members in Colorado. So we manage all of the behavioral health networks for RAEs 3 and 5, 5 being Denver, RAE 3 is Arapahoe, Adams, Douglas, and Elbert. So we manage all the behavioral health network, we help fund those providers, we pay those claims, and then we provide physical and behavioral health care management for those services through Medicaid. Colorado Access also has a CHIP program. This is the Medicaid expansion program. Generally serves children under the age of 18 and pregnant women older than 19. This is the map of the CHIP contract. So when people enroll in CHP Plus, they get to decide in most of the metro area if they would like Colorado Access, Denver Health, or Kaiser to manage their plan. Regardless, the plan, the Colorado Access CHP Plus plan really pretty much mirrors the Medicaid plan. There are some differences in that transportation is a Medicaid benefit in Colorado to and from Medicaid funded services. However, that is not offered to CHP Plus members. And it's also, there's some differences for the autism diagnosis. And if anybody ever has any questions about that, please don't hesitate to email me, but there are some differences in what is covered for autism. Regardless, dental benefits are covered by DentaQuest. DentaQuest covers cleanings, exams, x-rays, fillings, and root canals. They cover orthodontia if it is medically necessary. This member handbook that you guys will have the link to is really helpful. They have a whole Health First Colorado DentaQuest webpage, where it's kind of easy to find answers on what is covered and what is not, and who are in-network providers. Colorado Access also has a eligibility application partner site. This is super helpful to know. If you're working with people who you think need to enroll in Medicaid or CHP Plus or long-term care coverage, we have our own enrollment site like the counties. And then this provider site gives those applications to the counties for approval. So a lot of times there's less wait times, and we have some really wonderful trained staff that help guide people through applying for Medicaid. What does that look like? We're not doing on-site interviews right now because of COVID, but all of this team is available through email or phone, and we have a Dropbox at our Colorado Access location. There's many ways that people can get connected to care management. A lot of them come from community partners, such as you guys referring to a care manager, but there are some other ways that people can access care. So every behavioral health admission that is a Colorado Access member gets followed by a care manager. So say a child goes to Children's Hospital and they're seen in the emergency room and they need to go to have an inpatient stay at Denver Health, then Tiffany, who is assigned to Denver Health, will call that family at discharge and 2 weeks after to ensure that there's 7-day therapy and 30-day psychiatry visit, and then any other needs that were stated or recommended during that hospital stay. We do a similar thing with physical health, but because Health First Colorado pays those claims and Colorado Access does not, it's not a perfect science on us getting all of the information for those physical health expenses. We also launched a complex care management team maybe a year or so ago, because we know that behavioral health and physical health care management is very episodic, maybe 30 days or less to help people adjust after hospitalization. But really, there's a whole set of members that need more ongoing complex care management that is extended and past 30 days. So we now have a whole team of RNs that assist with those complex needs, whether it's sending kids out of state for residential care or coordinating surgeries out of state for kids or adults. It is a different team to help assist with that. Regardless, when any community partner makes a referral to this resource and referral email, which I will go over next, that really helps get the referral to which team member is really the best. So say you guys are referring to a behavioral health care management team, then that team can help seek the referral or whoever is the best equipped. We also get a huge list of all of our members from the state once a month on the 1st, and it has all of these fun divisions with like, these people have diabetes and asthma and COPD, and we try to stratify that list to really kind of see who needs care management help. And that's not a perfect science. So again, we rely on our community partners to tell us these are the people in you guys' network that really would benefit from care management and assistance. So in order to make that referral, you can fill out this care management referral form. I'll make sure you guys have a copy. It's also on our website. It's a pretty easy demographic form. Again, I really recommend you fill out as much information as you can on there, because we have almost 50 care managers who have a large array of expertise, LPCs, LCSWs, RNs that are trained to help this team. And so the more information, the better, to make sure it goes to the right person. Now, if you guys don't need to connect with us, you want to just send the referral, make sure we connect with the member directly, that's great. You can check this. Would you like care management staff to follow up with updates on this case? You can click no, and we'll just take care of it, outreach the member directly. If you click yes, likely a release of information will be required to be sent with it, and that link is directly on this form, and I'm going to go over kind of what that policy is so you know. The quickest way to explain it is that Colorado Access can speak to any provider or entity that is funded by Health First Colorado Medicaid. So say a kid gets hospitalized, we can speak to the ER, the outpatient team, the primary care physician, the inpatient hospital. We can speak to all of those people. We cannot speak to school districts, GALs, foster parents, advocates. that are outside that funding of Health First Colorado Medicaid. So that's kind of the easiest way to describe it, but I'll make sure you guys have this policy written down just in case you can refer back to it. We do have a policy for 15 to 18-year-olds because of the age of consent for treatment in Colorado. We do require 15 to 18-year-olds to sign their own releases to even speak to their guardian. That being because technically they can consent to their own treatment. And if a parent requested medical records or something, we would be breaking that Colorado law and then endorsing that that child is receiving treatment. We do have quite a few teenagers that do receive mental health treatment without their parents knowing in Colorado because they are allowed to. This is the release of information, pretty easy to fill out. On top is the member name. I just like to point out a couple like errors and things that are helpful. For instance, on this name part, it's really easy if people put Denver Department of Human Services or the entire entity name instead of their specific name, meaning if you put John Smith, who works at Denver Department of Human Services, we can only speak to John Smith. So if John Smith goes on vacation or leaves the company, then we can no longer connect with Department of Human Services. This drug and alcohol box is an extra box that needs to be checked if there's substance abuse related concerns or referrals needed. That is because there's a federal law that protects that information, just like it protects HIV/AIDS and genetic testing information. So that box needs to be checked. And then also the information to be shared covers the following dates of service. People tend to just put today's date, but that means that we can only share information on what happened today. And so I recommend people write all on there. Of course, people can release their personal health information however they want to and fill this out however they want to. I just like to point those out because I think that there's not the greatest directions on here, and sometimes it's not super clear about what these things mean. So just like if you guys needed an MRI or some kind of higher level of care from your primary insurance, we run that entire process for behavioral health. Now, I'm not going to go through all of this. We have a short amount of time, but the most important thing for you guys to know is that all outpatient services, individual family therapy, and psychiatry are covered without prior authorization, which means that these services can be provided there's no limits, there's no exceptions. Every Medicaid member with Colorado Access Medicaid gets all of these services, and we just pay the claim. In-home therapy services for adolescents under 18 are also included in this. So if you're working with a child that needs from maybe 8 hours of in-home through Tennyson Center or Mount St. Vincent, that is all covered without a prior authorization. They just get that service and are good to go. Also, things that are covered without any prior authorization are any services provided at mental health centers. And the reason that I really like to explain this is because when we're working with kids, there's some services like day treatment. For instance, if a kid needs to go to day treatment at Tennyson Center or a facility like that, typically that requires a prior authorization. However, services at like Skyline Academy, Hamden Academy, Community Reaches Day Treatment, those are all covered because they are a part of the mental health center program. Now on January 1st, the state decided that the raise should also cover substance abuse treatment. Believe it or not, we used to separate this until January. We used to separate mental health funding and substance abuse funding, and we all know you can't tease those things apart. And so on January 1st, we started covering that service. The state made it mandatory that people who are needing to receive a higher level of care for substance abuse treatment have an ASAM. An ASAM is a set assessment. It spits out these levels of care, 3.2, 3.5, and then Colorado Access approves that level of care and helps find a service for that. Because this is a new program, it's just been going for about 11 months exactly, this website is really key to help find substance abuse providers. There's an Excel document on this website that gives you all of the substance abuse providers in the state that are contracted with Medicaid, and it's super helpful because it's constantly changing as we're getting more providers enrolled in this new system of care. So regardless of if it's a substance abuse request or just a behavioral health request, the more clinical information that can be sent in, the better. All of that information goes with this form to the utilization management team. On that team, an LCSW, an LPC, or RN reviews it for medical necessity. If they feel like it might need to be denied, it's not a medically necessary service for that person, all of those go to a medical director who is a psychiatrist for review. So everything is reviewed by a clinician and then by a physician before there's denial. Then after that, there is a peer-to-peer in which the doctor requesting can speak to the doctor who denied the service at Colorado Access. And then after that, there's an appeal period. So there's a lot of ways that this information gets reviewed and can be appealed. And all of that information goes on a denial letter if there's a denial to the guardian or to the member's home, but sometimes we don't have our addresses updated and things. And so if that's ever needed from a member, please let us know. So this is my super fun color wheel that I made because I think when we're trying to help families navigate care in Colorado, it's really, really hard to explain to families because people can be getting levels of care and different services from so many different places with so many different acronyms. So in blue, we have Health First Colorado. That's Colorado's Medicaid program. They cover urgent cares, hospitals, durable medical equipment, all of that information, all of those services. Health First Colorado gives money to the RAIs to manage the behavioral health benefits and also to provide care management for everything the RAI funds and also everything in blue. Then we have the CCBs, so Rocky Mountain Human Services, Developmental Pathways, North Metro. The CCBs are community center boards, and they control all of the funding for developmental disabilities, including waivers such as CES or CHRP that really provide a lot of services for kids with developmental disabilities. Then we have the single entry point, which is Rocky Mountain Human Services for most of the metro area, and they cover all of the waivers. We think of single entry point mainly when we're speaking about services that are available for adults, such as elderly, blind, and disabled, but there are some waivers for kids, such as children with life-limiting illnesses, medically fragile children. And then this last part in the green is super interesting. CYMHTA is basically a funding source for those with private insurance. So this is not for Medicaid. It is for kids with CHIP or private insurance. And basically this came to be because Kaiser does not offer residential treatment for mental health regardless of how the severity or anything. It is just not a covered benefit. So in the state of Colorado, we have CYMHTA that can cover services like residential or other services that could be available to help kids, but is paid for by the state. So there are liaisons that do assessments on these kids, and then the state can decide if they're going to pay for residential or whatever services being requested that the private insurance will not fund. So as you can see from this wheel, kids and families can be receiving services from almost every area on this map, and it's really complicated and hard to explain to families. So hopefully this will help, and I'll make sure that you guys have a copy of this. Because this is all super difficult to coordinate, a lot of what we do at Colorado Access and Care Management is get everybody on the phone to talk about whose role is what, how do we best serve this family, how do we get people like school districts involved and the hospitals and everybody to the table to really talk about how to connect and best serve the child. So if you guys ever want to make a request for a staffing or a creative solutions call, please do so through that care management referral form and this resource and referral website, and we will coordinate staffing calls to help kind of navigate those services. If you guys are just looking for trying to find a Colorado Access provider, we have a Colorado Access provider search tool. This is what it looks like. It's really pretty nice. You can narrow it down from zip code, gender of therapist, specialty type. We have at Colorado Access, we have one provider for every 8 members. Pretty great. So a lot of times we get stuck in kind of thinking the mental health centers are great or the in-home providers, but we have a really, really large network that's able to see Colorado Access members, and this is super helpful. This is the Health First Colorado provider tool. Make sure you guys have the link to this. It is not always the most user-friendly, and that you can only really divide by like 12 specialty types, but it is here for you guys if you're looking for occupational therapists, speech therapists, primary cares, all of those physical health providers are on this portal. Regardless, the state has a separate contract for crisis services. So the crisis line and this text-to-talk line help fund all of these walk-in crisis services. Now, there are some walk-in crisis services that aren't on here. For instance, Community Reach Center has one, and it's not on here because they don't receive funding from the crisis line, but these are the current ones as they are right now. The reason I really want to make sure people have this information is that sometimes there's not a need to go to an ER. And at one point during the summer, we had about 30 kids sitting in Children's Hospital ER waiting for assessments because they get pretty overwhelmed. So if families don't want to go to an ER, maybe there's just suicidal ideation and not an attempt, these services are always available. I really recommend families try to call the crisis line first because they really know which ones have the biggest wait times. Sometimes there's mobile crisis units able to go to somebody's house and do an evaluation, which is just so nice and easy, but they control all of those services and know what's available. So this is the best resource for crisis services. I get asked about in-home therapy options a lot. A lot of times people are working with kids and maybe they're not doing well with outpatient therapy, they're not engaging, they need more services. These are the main 5 in-home therapy options in the metro area. They're all a little bit different, so I did kind of slice out which ones are different for what way and how to make referrals. For instance, Denver Children's Home has a case management service that helps with gang prevention and clothing and those things. Deborah Cleo Wallace has an outpatient Medicaid clinic at Colorado and Florida that is a psychiatry clinic. Last time I checked with them, they do not have a wait list for Medicaid kids. So if kids need to go and see a psychiatrist, they have that available. Mount St. Vincent is for kids under 12. Savio House has the most different kinds of modalities, and Savio House also tends to have the largest Spanish-speaking in-home team. Regardless, I know sometimes you guys are going to have to connect with other RAIs. Maybe somebody just moved here. Maybe somebody sees a primary care outside of the metro area. So this is how to get in contact with all of the RAIs. And then if you guys ever need connections to them, please let me know. I'm happy to send those emails and connect you all if you're unsure. And then this is a little bit about my role. I started in my role in January, really because we have this whole provider team that helps providers, but we didn't really have anybody to help with those entities that we collaborate with a ton that serve our shared members. And so my role is to help connect with Department of Human Services and school districts and really collaborate on how we can help assist our shared members because we don't always do the best job at connecting. So please feel free to reach out anytime. If you're ever working with somebody and you're like, this person just doesn't understand how Medicaid works, please feel free to give them my information. I'm happy to connect with anybody and share this information, help them walk through this really confusing process that we have in Colorado. Okay, I did this super fast. So please let me know any questions and I'll make sure that you guys have this presentation and all the materials via email as well.
Well, thanks, Lauren. And you're so on top of things you already sent me, like all the follow-up materials a few weeks ago. So we've got those ready. I'm sure there's questions in the Zoom room. And while people are thinking those, we had a question in the chat from Mary. She asked if a newborn is auto-assigned, for example, to Denver Health Medicaid, and they would like to change, what's the best way to do this?
So the best way to do that is to change their primary care physician through the Health First Colorado website, the PEAK app, or that number on the very first slide. Denver Health Medicaid is a little funky. It is an interesting plan. Basically, you get all of your physical health care through Denver Health, and then Colorado Access manages mental health, but it does kind of lock the physical health stuff into Denver Health. So the best way to change it is to change the primary care physician away from Denver Health, pick another provider. I will say that sometimes it does change. Like if somebody is receiving a ton of specialty care at Denver Health, sometimes their Medicaid will change to Denver Health plan. And that is part of the state's algorithm and such. And so sometimes it does need to be changed back, but that is the way to do it.
I had a question sort of for the group, which is, has anybody heard from community members or clients about using, Lauren, you recommended calling crisis services if somebody, to get more information and to sort of help navigate the system. And I was wondering, I think there's been a lot of sort of overhaul of the crisis system in the last few years. And has anybody referred folks there and gotten any feedback about how successful that is or not? I'm just curious to know.
I actually have a friend who used the crisis services available in Arapahoe County using the Colorado Crisis Services hotline and all of that. It was very easy and supportive to get them into a program and get them moving on to where they sort of needed to be. I can't really speak for how that would work while also coordinating a youth, or how that would work for a youth because they are 22. But I can say that calling them and getting all that information wasn't too hard.
Thanks, Joey. Lauren, there's another question in the chat from Mandy. What about oral health services? Is that through Colorado Access or coordinated with another organization?
So oral services go through DentaQuest, and the link for the Health First Colorado DentaQuest website is on one of those slides. And I recommend trying to use that first because DentaQuest manages all of those things. And sometimes it's easy to find the answer on their own website. If you have any issues, I'm super happy to reach out to them. I think a lot of times what happens is the people call that number, that 888 number, and there are some really long hold times and people get frustrated. But the Colorado Health First DentaQuest website is actually pretty user-friendly. So I'll make sure that is on one of the slides that Rebecca has already. The biggest question we get asked with kids is orthodontia covered? And it is if it's medically necessary. So if a dentist decides this has to be done and makes a prior authorization request through DentaQuest, they very frequently get approved, but just cosmetically, it is not covered.
Well, thanks so much, Lauren. I think in the interest of time, we need to keep moving. So you're welcome to stay on or jump off, but really, really appreciate you being here and sharing such great slides, and we'll be sure to get those out to the group.
Great. Thanks, Rebecca. Lauren, thanks again. So informative. Hi, everyone. I'm Shailyn. I'm the other co-chair with this group along with Rebecca, and I have the pleasure today of introducing two folks from Envision U. I had a chance a few weeks ago to hear from one of their colleagues present, and I thought that this would be a good topic for this group as well today. So with that, I'll introduce Brad Barfield, who is the program manager at Envision U. And Joey, I'm not even going to attempt your last name. I'm so sorry. So please introduce your last name as well. And with that, I'll turn it over to the two of you.
It's fine. I don't need a last name. We just don't worry about it. It happens all the time, I swear. And it's just, there's nothing you can really do about it. So hello, are you all able to see our slides okay? Fantastic. One sec. If I do the grid video, it'll let me see all of y'all, and that's absolutely fantastic. So once again, we are from Envision U. My name is Joey Kyle-Di Pietropaolo, but you can just call me Joey because it saves us so much time. I use she, her pronouns, and I'm an AmeriCorps Vista member currently serving with Envision U.
And hi, everyone. My name is Brad Barfield. I use he, him pronouns and have been at Envision U as a program manager for 2 weeks. So brand new to the org. But very, very excited to be here, and thank you all for showing up today, and Lauren for a great presentation.
Yeah, absolutely. So when we go into presentations like this where we're talking about working and supporting others, the first thing that we really like to do is frame the space. And today we're going to do that with a short breathing exercise. It's called 4x4x4 breathing. So I'll go ahead and count off if you all are interested in joining me for it. It's going to be in, 2, 3, 4, hold, 2, 3, 4, out, 2, 3, 4. And we can go ahead and get started right here. In, 2, 3, 4, hold, 2, 3, 4, out, 2, 3, 4. In, 2, 3, 4, hold, 2, 3, 4, out, 2, 3, 4. In, 2, 3, 4, hold, 2, 3, 4, out, 2, 3, 4. Last one. In, 2, 3, 4, hold, 2, 3, 4, out, 2, 3, 4. And now we're ready to go ahead and start. And what we're talking about today really is getting information out there about how to better support queer and questioning youth in regards to their identity. And what we're really focused on is, even though we don't have all the answers, with the evidence that our organization and a bunch of other organizations have gathered, there's a lot of information out there about different ways that we can all work together in order to support LGBTQ plus youth and the identities that they hold within themselves. And that this directly affects their mental health outcomes, their substance abuse treatment outcomes, etc. And we're all here just sort of to guide each other on a way to become better supports for these queer and questioning youth. And basically, our ideals for this program today and what we're talking about is to set up an environment where each of us are able to learn about how to understand the perspective of youth who are questioning their identity, or understand how to better support youth who are LGBTQ plus through the journey of looking at their gender expression and their sexual orientation, along with connecting with each other and resources that would be able to help us on that journey to help these children thrive as their true selves. And the first thing we really wanted to open up with today is, this is just a short video about the importance of being prideful in our identities that the Trevor Project put out with the help of Demi Lovato a couple months back. It's just a couple minutes, and here we go. Can everyone hear? No? Haha, we ran.
When you see this parade, what do you see? You see people from all walks of life, owning their power unapologetically and using it for those who need it. You see resilience in 1,000 forms, the strength to stand up despite so many reasons to sit down. You see imagination at every turn, a brilliance shared by creative minds, writing stories, solving problems, and painting pictures that will become our history. You see the unrivaled diversity of our people, our ideas, and the ways we're building our future. You see the energy that guides us, that drives us, that promises we're a part of something big and growing. This is not a parade, this is pride. And pride isn't going anywhere, because pride is everywhere. When you see this parade,
There we go. Haha, did it. So yeah, and when we start talking about this, one of the most important things for supporting LGBTQ plus youth in embracing their identity and helping them find the resources that they need in order to be able to thrive is making sure that everybody is using the language that allows for that to happen. And this all starts with the LGBTQ plus acronym, which is something that a lot of people are familiar with, but not everybody always knows like all the individual aspects of each one. So lesbian stands for a person who identifies as female and finds themselves attracted sexually and or romantically to only females. Gay is usually a person who identifies as male. and finds himself attracted to other male identifying people. Bisexual is a person who finds themselves attracted to both people who are female and male. A person who is transgender is a person who does not identify with the gender that they were assigned at birth. And people who are queer or questioning, we'll get into this a little bit more specifically later on, but it tends to be used as an umbrella term for people who don't fit in some of the previous sections, or people who are still trying to figure out who they are and how they fit into the LGBTQ plus community. And the reason why the plus is there on the end is it's meant to be inclusive of all the identities that don't fit into those first 5 letters. So identities like people who identify as two-spirit, people who identify as pansexual, et cetera, et cetera. And by having this plus on the end, it sort of future-proofs the acronym. It would be nice to be able to consider putting in every single letter of all the different possibilities of people who identify as LGBTQ plus. However, it's such a diverse community that it's really hard to do that without creating like a 37-letter acronym, and it gets very messy. So this is what the LGBTQ plus community has sort of settled on right now as the most inclusive way of grouping everyone together. So when we talk about a person's sexual orientation, this is just one part of a person's identity that affects social behavior, how they affiliate with others, etc. And when we're talking about sexual orientation, we're talking specifically about how who a person is sexually attracted to. And this can be different for very different people. Some people are attracted to people who present in a certain gender. Some people are attracted to people regardless of the gender that they're presenting in, etc. And this can even be completely separate from romantic attraction. There are a lot of people who can be romantically attracted to many different people, but only find themselves sexually attracted to a person who presents in one gender, things like that. When we're talking about gender identity expression, this is something that's completely different from sexual orientation. So gender identity is all about a person's internal understanding and how they experience their own gender. And everyone has different gender experiences based on their personality, the ideas that they have, where they were raised, the environments that they grew up in, different people that they interact with, etc. And originally there was this gender binary, which was the go-to for the longest period of time, where you are either male or female. But nowadays in gender theory, we've really moved away from the gender binary, and it's really more focused on sort of where you see yourself gender-wise, what is comfortable for you, where do you feel like this is who you are as a person, etc. And gender expression is how you take your gender identity and you show it to others, sort of. So some people like to have a gender expression that matches up exactly with their gender identity. Some people feel a little bit more quiet about how they want to do their gender expression, etc. And it really depends on each individual person, how their gender identity, their gender expression, and all of these things sort of work together. And this is sort of a good picture of how those things interact with each other. So this is a resource that a lot of different people use called the Gender Unicorn. It's completely free use. If any of you need to use it in your own work or anything like that, you can just go to transstudent.org/gender, and you'll be able to pull this up as a resource. And it shows how there's differences between gender identities, gender expression, sex assigned at birth, physical attraction, emotional attraction, etc. And how these things can all sort of interact. And what's really nice about this is you can print this out, and it's something where if you're working with a youth who's thinking about how these things sort of interact and all of that, they can put little dots where their sort of identity is. So they can do things like, oh, well, I feel like I have a very masculine gender identity, but I prefer a more feminine gender expression. This is my sex assigned at birth, etc. So yeah. And another thing we wanted to talk about is when we talk about a person whose gender identity does not match the gender they were, the sex assigned at birth, Those people are normally defined as transgender. There's some people who don't like to use this moniker in order to identify themselves. There's some people that this identity is very important to them. They're very prideful in their identity as a person who's transgender. And that's something that, once again, really varies on the person and just speaks to how important it is really when we're working with queer and questioning youth to take a minute, sit down, talk with them about sort of what they're thinking about, where they're comfortable, what are some things that they want to talk about, etc. When we talk about a person whose gender identity matches the sex that they were assigned with at birth, we define them as cisgender. This is not an insult. This is not something that means that they are supposed to be a straight heterosexual person or anything like that. It's just a term that shows that they are not transgender, and it's something that is often used. Yeah, and then here we get to the queer and questioning segment. So when we talk about a person who is queer or questioning their identity, it's often used nowadays as an umbrella term. It used to be used as a slur against members of the LGBTQ plus community, but it's really been sort of taken back and used to define a person who is not really heterosexual, not really cisgender, trying to think about where they want to be, who they are as a person, where they fit into the community, etc. There are a lot of people who will describe themselves as queer. They'll talk about themselves like, I'm a queer person, or I identify as queer. But it's not something that you always want to use right out of the gate to work with a person, because it still does have that notation of originally being a slur against the community. So it's normally something that you want to talk with the person who you're working with beforehand, or it's something that you can use if they identify themselves as it first. So yeah, awesome. Then I'm going to pass it on over to Brad.
Awesome, thank you, Joey. So we're going to talk about, for a little while, I'm going to go through this relatively quickly, about some of the outcomes associated with queer youth and questioning youth. And so we're going to start with rejection. So not surprisingly, rejection, particularly familial rejection, is still, unfortunately, a very prevalent experience for LGBTQ plus people. Youth, yes, but also all folks in the community. So 68% of homeless LGBTQ plus youth have experienced family rejection, and 54% of LGBTQ plus youth, housed and unhoused, have experienced some sort of abuse within their family, whether that's physical, emotional, sexual abuse. And the results of familial rejection are devastating. So queer children with high rates of family rejection are reported to be 8.4 times more likely to attempt suicide, 5.9 times more likely to report high levels of depression, 3.4 times more likely to use illegal and illicit substances, and 3.4 times more likely to engage in unsafe sexual behavior than their cisgender and heterosexual peers. The fear, realized or not, of familial rejection means that gender minority youth are 5 times more likely than cisgender youth to rely on online support rather than in-home support. And in the same vein, queer youth have said the most important factor in their lives was the non-acceptance or the acceptance they received from their family or a trusted adult. So just to give you all some very recent context, we have a couple statistics this just from last year. In 2020 alone, 1 out of 3 queer youth have experienced physical harm, 60% of LGBTQ plus youth have experienced discrimination, and 29%, 1 out of 3, have experienced homelessness or being kicked out of their home. We cannot understate the devastating nature of these statistics. They are directly related to the non-acceptance of queer youth's gender and sexual identities, and demarcate the cruel truth that exists in these kids' lives. So given some sobering stats and stories, but we do have some silver linings. While queer youth at large are at much higher risk for significant mental health challenges, we know that even one trusted and accepting adult can make a world of difference. And a community that rallies around that adult and that child profoundly increases those results. So acceptance helps you feel supported. They're more likely to grow into thriving adults. And overall, family acceptance drastically affected how many queer youth were reporting suicidal thoughts and actions. So the youth in low acceptance families were almost 20% more likely to be suffering from suicidal thoughts than mid and high acceptance families. And youth in low acceptance families are also 20% more likely to have attempted suicide as well. Thank you. So one way to think about helping with acceptance of LGBTQ plus youth is through this concept of family and parent consciousness. So family consciousness means basically just being mindful of reactions, particularly to reactions of youth. And it requires family members, adults, to really be self-reflective and to look at their own unconscious biases that drive their beliefs and actions. There's no right way or wrong way to practice family consciousness. It's definitely a journey, but it's a way for family to connect with their children primarily through the lens of love, acceptance, non-judgment, compassion, and support, instead of through the lens of ego, fear, and control. This helps to create a safe and welcoming and accepting space for kids to explore their sense of self, which again is a journey, not necessarily a destination, and being present and engaging with whatever arises. That's really what acceptance means in this context, which of course is not always easy, but can be slightly easier with other caregivers and supporters in Family's Corner. And so now we're going to talk about support systems. So these are challenging topics. Parents and families, they have identities that they hold very true to them as well. They have identities that they have placed onto their children. That's what society tells us to do. It's not necessarily inherently wrong, but it's important that families feel like they're not alone in processing their feelings about LGBTQ plus youth, their youth, and others. So what we suggest is that caregivers can work together to feel connected, process their feelings, their questions, maybe even their misunderstandings around their children and the children who also exist in the queer community. And one way to achieve this is through support groups, which have been essential to help with the process of moving from understanding to acceptance. Acceptance is the goal here. Actually, celebration even is the goal here. And keep in mind that every caregiver's timeline for sort of like making that journey, that understanding to acceptance to celebration, is going to be unique. There is not there's not an inherently a wrong way to do this. There's not a time at which if someone hasn't gotten to a particular state that they have failed in being accepting or celebrating, or that they won't be able to get there. But we do know that caregivers that find those supportive networks, find folks outside of themselves in their family unit, are more easily able to view that whole experience and process through a lens of acceptance. So wanted to thank you all. This is like the end of the didactic part of our presentation, and I'm going to open it up for some group discussion and questions.
Brad, Joey, thank you so much for the information today and for joining our work group. So do we have any questions from the group today?
We'll also make sure to send along these slides and our contact information. So if folks do have questions later on or questions they don't want to bring up in the group today, more than happy to have conversations afterwards. That is what we are here for.
Yeah, absolutely. I will make sure that my email gets out to everyone, because that's part of my role here at Envision U, is making sure that we're doing community connections and talking with people who need support about how to work with LGBTQ plus folk. And that's something that I'm always available for, even if you just need to go get a coffee and talk about some stuff that's going on. We also have a large resource list that we've been working on for a little bit ever since I joined on. So if it is a situation where this is something that you are looking for more resources about, be that print, television, movies, podcasts, websites, etc., that is also some information that we'll make sure to sign out. We have a couple different sheets that we'll send out, but other than that, always feel free to reach out, because I'm also always looking for new books and materials to be able to use. It is the teacher in me that will not die. So yeah.
Joey, you took my.
I actually have a question, Shylin. Can I go ahead and, okay. Hi, I'm Mandy Ashley. I'm with the Aurora Health Alliance. I was having a conversation with my best friend who teaches at an alternative school in the Midwest. She teaches English, and she sent me a question like, hey, I don't really know how to bring up, I just want to make sure I'm getting my kids' pronouns correct when speaking with them, but I have no idea how to even go about doing this. What do I do? And I was like, I don't know what to do, so I'm asking you.
And then I think my first question about that would be, what age about are the youth that she works with?
They are high school students.
Oh,
so
high school students.
Yep.
Yeah.
Like 15, I think 15 to 18.
Yeah, that's fantastic. That actually works out really well, because then it's a lot easier to do one-on-one conversations with them. So it's always something that you can bring up. The best way to learn a person's pronouns is to take a minute when both of you are in a space where sort of not everyone else is around, because you don't want to be in danger of outing them in a potentially dangerous situation.
Right.
And just be like, hi, I just wanted to get a second to meet you. My name is blah, 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 blah. My pronouns are, insert pronouns here. What's your name and what are your pronouns? But the next step to really do that is, whenever you are introducing yourself, be that in a group, be that in a new situation, be that you're just getting a coffee, you can always go, hi, my name is blank. My pronouns are blank and blank. What is your name? And you sort of leave the door open for them to put in their own pronouns if they feel comfortable doing so. It can be really tricky sometimes, because people will feel like, oh, like that's something that you're just doing, it doesn't actually help. But it really does open the door, especially if you can get that chain going and show that this environment might be a little warm, because a lot of people who identify with gender that doesn't match up with the sex they were assigned at birth with are really uncomfortable talking about that in front of a large group of people that they're not familiar with, because it presents a danger to them. Like, it's something that I didn't do at all when I was a child. Like, I would never ever talk about my gender identity in front of others until probably I was 20, because there was just a lot of situations where I don't really know what's going to happen. I don't really know what people are going to be comfortable with. I don't know where everyone else is at, etc. So the goal is to open the door for conversation, be that through one-on-one contact or adding your pronouns in when you do introductions, and then sort of seeing how that works out. And if it still feels like it's a really difficult situation, there's always the next step, which is you can always bring up gender diverse content. So books, media, things like that. So for example, if you are an English professor, it's always something that you
She's
can add.
an English teacher, so this is good. I like it.
Exactly, right?
Yeah.
Pronouns can become a lesson structure. And once again, being very careful not to out anyone potentially, but talking about the fact that pronoun structures and pronouns are a very personal thing, and that this is sort of the junction between English and culture and English and identity, and how you can use the English language to sort of bring yourself out and stuff. Or it's a way to bring more gender confirming media into the classrooms. Young adult fiction has really expanded in availability for talking about gender diverse identities. Even if it's like you just need another fiction novel, there's plenty of fiction novels out there that talk about people with diverse gender identities and things like that, that you can bring into the classroom and use as a discussion starter moving forward.
Okay, that's really helpful. Thank you.
Yeah, for sure. I was a language teacher for a little bit. It was Japanese. It was a very different experience. Um, because in Japanese, you don't really use pronouns. It's very impolite to define someone with a pronoun because it's like, I don't know your name. You are not worth me knowing your name sort of situation. But this was how we used to start conversations about pronouns there.
I also want to call out a comment in the chat from Kate, saying that her husband is a high school teacher, and on the first day of school, he may have his students fill out a who I am page that includes pronouns. And so they also talk a lot about these topics in global gender studies classes.
Yeah, yeah. And that's also that's another really fantastic resource for trying to keep this information private as well too. So you could open that up as, I just like to collect a little bit of information about you so I can just like know more about you. You know, what's your name? What are your pronouns? What's your favorite color? You know, whatever. And then you can keep that in a private file, you know, like this is my information so that way I can remember your name. But it's also making sure that you're providing a gender affirming space.
Thank you, Joey. We also had a question in the chat from Rebecca, curious about if the trainings provided at Envision U are free or is there a fee?
Yes. So we offer a few different trainings right now. So one of the trainings that we offer is our behavioral health provider training program, which is the but you can just call it the behavioral health provider training program. That one does have a fee associated with it. And it's given in 2 levels. The first level is sort of some of the entry level stuff that we were talking about today, but more in depth. It is a multiple hour training that you take on your own time. We're working on a new fee structure though. I don't know if you know more information about that.
I do, but we're not at liberty to share it quite yet.
Yeah.
But to Joey's point, those and we've given lots of free trainings out. Again, those are for behavioral health providers specifically, and not necessarily just clinical ones. Also folks who are peer supporters and social workers, but for folks that are sort of seeing folks in a relatively formal setting. So yes, there are certainly for folks who need it, ways that we can think about pricing structure that gets this training, that particular training, access to the widest variety of audience we can.
Yeah, precisely. And then separate from that, we're also working on a program very similar to what we presented today that would be given over a much longer period of time, 3 to 6 hours spread across 3 different weeks, that really gets into the nitty gritty of, is it my fault that a child is LGBTQ plus, you know, is it like, which it's never your fault. And it gets into like a lot of the different information and things like that. But we're also always willing to meet with different organizations or different groups and give presentations like this, or just come in for conversations, or come in for what we call lunch and learns, where we just all get together, order some sandwiches and just talk, and things like that. And that's something that is just really important to us as an organization, making sure that people know that we are out there and that there are organizations trying to make sure that LGBTQ plus folk are getting gender and personally affirming care for behavioral health and substance abuse treatment.
But to Joey's point, I know we're running over time. Stay tuned. You know, we're still a pretty young organization, and there's a lot of content that's being developed at this moment. Right now, we're excited to get out into the community, and we also want to make sure that content is as approachable and as accessible as humanly possible. So to the question about fees and costs, that's always a major concern of ours in trying to figure out how it is that we can get the most reach to the most folks. So stay tuned. We will definitely let you know as new content comes out, because we're trying to get it out to everybody.
Well, Joey and Brad, thank you again so much for the informative presentation today. We'll look forward to receiving your materials and make sure to share widely with this group as well. So thank you so much. And with that, I think, Rebecca, we wanted to end today, close out our, this is our final meeting of 2021.
I just want to say thanks to Rebecca and Shylin for doing such a great job with our kids interest group as our co-chairs. So thank you both so much. Looking forward to an exciting new year.
Teamwork makes the dream work. That's true in this instance. Well, everyone, thank you so much for joining us today. We look forward to staying in touch and opening up 2022 together. Rebecca and I, we are interested if you have idea topics for the upcoming year. Please, as always, feel free to reach out to either one of us or any of the work group kids staff team as well, as we're really thinking about continuing to bring presenters and topics that you all really want to see and that are engaging. So we're open to suggestions. Have a wonderful holiday season. Stay warm and everyone stay healthy and well. Take care.
You too. Thanks, everyone.
Thank you.